Good afternoon, everyone. Welcome to this month's AFPHM webinar. Today we have Dr. Ben Scalley presenting on human health risk assessment. Dr. Scalley would like to keep this session quite interactive, so if you would like to use the chat function throughout the webinar to communicate, that would be great. Any questions, please use the Q&A panel. They will be answered throughout the webinar. I'll now hand it over to Dr. Ben Scalley.
Okay, thank you. Hi, everyone. So today, as mentioned, I want to talk about human health risk assessment. I wanted to keep the session really practical rather than overly theoretical. I've simplified in sections just to highlight certain points. So I'm going through real cases, but I've really simplified down a lot of the findings and tweaked them to make them a little bit more, I suppose, educative. So the numbers and the details of what we're going through today are not quite reflective of the situation that actually occurred, but so play along with me a little bit. But the reality is sometimes a little bit more complicated than that. We'll make a start, but we'll keep it really practical and simple. So I thought it might be good to start more broadly talking about environmental health. I know there's a few people sitting the exam, and it's good to know where human health risk assessment's place is more broadly in environmental health, because I know a number of trainees don't always get a lot of exposure in environmental health. So just thought we'd set the scene a little bit. Then we'll spend the bulk of it talking about human health risk assessment and giving a couple of examples that sort of give you a bit of an overview of how we would actually do it in a practical setting. I can't actually see. I'll just move this box out of the way, sorry. So environmental health involves the aspects of public health concerned with, and I'll read this, the factors, circumstances and conditions in the environment or surroundings of humans that can exert an influence on health and well-being. Now, if you really think about that definition, you're hard-pressed to find something that you wouldn't consider environmental health. Environmental health is really very broad, and a lot of the definitions really bring in everything. As a medical student, I actually remember being a bit of a bit smart in my replies sometimes to consultants, and they would say, what caused this disease? And I would say, while I was trying to think of what the actual cause was, well, it's an environmental insult in a genetically susceptible individual, which was true for almost any disease you could think of. And little did I know I'd end up in environmental health, and that definition would almost be what I did. So environmental health is really very broad. Sorry. But sometimes broad definitions aren't always of great benefit because they can be so broad as to be unusable. So I think it's better to narrow things down a little bit, and often environmental health would include some of these key parts, and I've got there sanitation, so meaning making sure that when you dispose of your urine and your poo, that it doesn't come back and contaminate your food or your drinking water, essentially. Drinking water quality. Spend a lot of time in my branch looking at drinking water quality. Contaminating someone's drinking water supply is a really good way to make them unwell. Especially internationally, it's a major problem. But if you think about it, if you were looking for ways to cause ill health, contaminating a large city's drinking water supply would be a very good way to do it. And conversely, if you were looking for ways to improve people's health or protect people's health, spending a lot of resources on ensuring your drinking water is top quality is a really good way to make sure of that. And similarly, food safety, although a little bit harder to ensure, is really important. And lots of environmental health officers around the country include food safety. And like drinking water, that can be chemical or microbial food safety. Another part is controlling diseases. So this can be chemical or microbial as well, and I won't talk about that in too much detail. And in some places, housing conditions. So some of these functions sort of started in environmental health and have gone out into other areas. So a lot of building codes were in the health departments previously, but now tend to be in standalone organisations. But we still do a bit of work. So, for example, my area does work called Housing for Health, where we work in Aboriginal communities to ensure sort of the building blocks of health are present. So we look at sort of characteristics of housing and making sure they have, ways they can wash themselves and their hands, wash their clothes, good kitchens, and have a safe environment in the house. We spend quite a bit of money, but I think for good returns. And this box is a bit in the way. Sorry, I can see myself in front of the words. Central really to the significant improvement in a lot of the got here quality of life and longevity. So it's really about both. Over the last 100, 200 years, there's really been improvements in a lot of these aspects. So if you think, for example, about diseases like tuberculosis, a lot of people, when they think of the really quite dramatic reduction in tuberculosis that we've had over pretty much 100 years or a little bit less, people tend to jump towards things like antibiotic use or perhaps even the sort of public health follow-up of tuberculosis cases or other management from a public health point of view. But perhaps housing quality and reducing overcrowding are probably the most important factors in doing that. So those interventions preceded a lot of those things and would potentially explain why we saw a decrease in those diseases prior to antibiotics and other interventions that we tend to point to. So environmental health is awesome, you see. Oh, what is this thing doing? There we go. But today we'll focus on one part of environmental health, which is health risk assessment. And also I'd like to put in there the management of these risks. So just like in the hospital system, sometimes people can get caught up in diagnosing something and then they get to the end and they think, are we actually doing something about it? People can get caught up in the diagnosis and the theory of the disease and then forget what the whole point of it was. Health risk assessment can be a little bit similar in that people can spend a lot of time assessing what the risk might be, but it's really important that the end goal of actually managing those risks isn't lost and where we're heading. And that also risk management is often, we think of it schematically, I suppose, as you assess the risk and then you manage the risk. But it's important that you think throughout of managing those risks. And I'll talk a little bit more about that as we head through. I've done it again. There we go. So just a bit of a scenario, and this is a short one just to get you thinking about the structure of health risk assessment. So I've got here that you're working as a public health physician in Newcastle, and I've chosen Newcastle because it has a number of contaminated sites and interesting issues. And one is that the scenario is 3 days ago, an ammonia plant had an uncontrolled release of a condensate. So it just allowed some material to sort of come out in a gas sort of form. And the condensate was identified as predominantly sodium and chromium ions. Now, to someone who works in environmental health, that probably should ring alarm bells and ask for follow-up questions, which I wouldn't expect all of you to know, but there's 2 types of chromium, or perhaps more, but 2 main ones. And about 2% of this was estimated to be chromium-6, which is definitely a problem. And I'll explain why. The wind blew this material over Stockton, which you can hopefully see on this map here. So Orica is the company and the facility in the middle there. It's a little bit small, but you have to believe me, it says Orica and there's a red dot. And the arrow is showing the direction of the wind. And Stockton is that sort of peninsula there where there's a number of houses. And the purple, yellow and blue are detections, and green's areas that weren't detected. But they're houses, and this happened a little while ago, but from memory, there was a daycare in that area as well. And obviously a lot of concern. Now, next question would be, so what was the concern? So essentially people have been exposed to what we call a group 1 carcinogen, and that means, or a known human carcinogen. And what that means is that it's a substance that is really clearly associated with cancer. So that understandably raises a lot of concern for people. Now, you've got that scenario. Well, what do you do next? And, one approach would be that's happened and you observe these people for a number of years and see if they have any ill health. The problem with that approach is it doesn't lead to a lot of reassurance or otherwise for people in the short term. And it also doesn't lead to risk management, because if you have to wait and do a study on ill health, you're waiting until the ill health occurs before you manage it. So health risk assessment is a process that you can do somewhat immediately, and more naturally leads to risk management, and you can communicate risks earlier. So it's definitely the preferred approach. And so risk assessment is the process of estimating the potential impact of, I think it says a hazard, often chemical, on a specified human population under a specific set of conditions and for a certain time frame. So the language there, I think, is out of the Health Risk Assessment Guidelines, which is a great document if you ever need to do it in a bit more detail, and probably worth a read prior to your exam. Not necessarily the whole book, but especially some of the earlier chapters. It's quite a good book to get a bit of detail of health risk assessment. It also introduces you to a bit of the lingo. So if you're sitting your exam soon, you can kind of brush up on some of the right words to drop in to a scenario that includes health risk assessment. Now, this is the book I mentioned, Environmental Health Risk Assessment from NHealth. So NHealth is a committee Australia-wide that includes people who have my role as heads of environmental health across the country, and also includes federal health. And it's really, I suppose, probably the most sort of important document for health risk assessment. And what I pulled out there is the major sections of health risk assessment that you really, really need to know as a public health physician, and especially if you're sitting your exam or planning to in the future. You really need to know these general sections and roughly what they, not even that roughly, what they mean. It's very, very important. So just to use this structure for this example, so the first is the issue identification. And you can read in a little bit more detail what this means in that text. But essentially, like it says, you're trying to identify what the issue is. Now, sometimes people tend to jump through this issue and think that they understand perfectly what the issue is. So here you would say, oh, well, it's easy. It's the plume of chromium-6 moving across Stockton. But sometimes we presume we know what the community is concerned about, and you can actually get quite some way through a health risk assessment and not realise that you're not actually answering the question that is of concern to the community. Or probably more often, you're half answering the question. You're not, you know, the community is concerned about something that doesn't completely align with what you're concerned about. So it's important to talk to the community before you run off too far in doing your health risk assessment, just to make sure that you're covering off on their concerns. Because remember, this process should be about the community, not just about your sort of more kind of scientific, I suppose, approach to it. So need to consider both. So that was issue identification. The hazard assessment. So this is another important concept here of hazard. So hazard is completely different to risk. So hazard is really, it says here, examines the capacity of an agent to cause adverse health effects. So it's kind of like the inherent property of the thing. So, for example, benzene or chromium-6, or I'm trying to think of things that you might say arsenic, right? It has a sort of inherent property of being very toxic. That's but that doesn't necessarily mean that it has a health risk. So say you had arsenic and you had it in a sealed bottle, and no one's drinking it, and no one could drink it, and it's protected and it's away from everything. That's a hazard, but there's no health risk, because unless someone is ingesting it or exposed some way to it, there's no health risk that flows from that hazardous substance. So hazard assessment is looking at what the substance could potentially do. It doesn't mean there's necessarily a health risk as yet. So in a hazard assessment, often you would look at whether a substance might be, you know, say a group 1 carcinogen, or what other health effects it might have. So it might be a developmental or reproductive toxin, or it might have other sort of endpoints of toxicity as well. So that's the hazard. The other part there is the dose-response relationship. So imagine for this, at different levels of exposure or different doses, what it can do. So for some substances, there are safe levels where you give a small dose and essentially nothing happens. And then at a certain point, you start seeing outcomes. And those outcomes might be things such as liver damage or increased malignancy or something like that. And so you could imagine a graph where it goes from no effects. At some point, there's sort of like a bit of a sigmoid type thing going on where you start to see impacts. And then at a higher dose where essentially all humans or animals that are being studied have an impact from the substance. And that's the dose-response relationship. I've already spoken you through some of that, but the hazard for chromium-6 would be that it's a group 1 carcinogen. And dose-response relationship, there's certain guideline values that often we would use for different substances. So it's really important if you're sitting your exam to know where you might go for the guideline values. You don't need to memorize any of these guideline values, but it's good to have in your brain some places that you would go. And what I would normally say is that, you know, there's ToxNet is a good initial place to go, which is essentially a website that searches a number of other sources. And so from places like CDC, which the CDC have a part called the ATSDR, which I can't remember what it stands for, American Toxicological something. And then the US EPA has some guideline values as well. And then there's a number internationally within Australia, but you need some words there, both for your exam, but also for your practice to know if you have this issue where you'd go to look up guideline values. And in general, guideline values, there's different levels, but there's also a different time points, and it really depends on the substance. For some things, acute exposures are really important, and for others, it's only sort of chronic exposures that are important. And some even have subacute exposures and things like that. But it often depends on the mechanism of action of the substance and how it's causing toxicity. I think it's important at this point to note one thing, which is almost no substance causes cancer from a one-off exposure. It's extremely unusual that you get a one-off exposure to something that will cause cancer. So exceptions would be sort of radiation Chernobyl type events, but they're not common, thankfully. And some really sort of rarely exposed to substances, essentially normally substances that are used to treat cancer, but a one-off exposure to them at a high level could as well, but that's not normally something you would come across. So essentially, one-off exposures to substances that cause cancer don't cause cancer. Okay, you need a chronic exposure normally. So now the exposure assessment. So before we had the hazard, which is the sort of inherent nature of what the substance can do to you if you're exposed. Then there's a dose-response relationship, which is at what level of dose will it do the sort of health outcome. And then this then needs to be compared against an exposure assessment. So this is really about looking at how much the substance could potentially have made its way, or would under a certain scenario make its way into people's normally surrounding populations' bodies. And it's really about characterising the magnitude, meaning the amount, the frequency and the duration. And you can see they're all sort of related, but it's really about the total amount of it over time. Now, a really important part of thinking about exposure is exposure pathways. And it's really important to consider that there's lots of different ways you can be exposed to things. So I think that might be on the next slide, but I'll just finish with this last bit here. It frequently uses model data because nearly always it's hard to know exactly how much someone was exposed to. So we often do, say for air quality, things that are in plumes, we do plume modelling to sort of look back on what might have occurred. So in this situation, it's occurred and we need to know what may have happened, and also in other situations where we're trying to predict something that's going to happen, what the health effect would be, that we use modelling data. So more often than not, we're using modelled data. And it's really important to consider all important pathways. So in this example, you probably straight away think of that plume and inhaling that plume. But I've just got a few other examples to sort of expand your thoughts a little bit on it. Inhalation from resuspended dust. So imagine if there was a plume of dust comes across and it lands on the ground. It's the middle of the night and people are breathing inside their house and inhaling some of the plume, but perhaps not much because it's sort of outside, and the air exchange into the house is not always that high. So it lands in dust. But then the next morning, people get up and they walk outside their house and the cars start driving down the streets. That dust that's landed on the roads, the footpath, on cars, gets resuspended and people can inhale it again. So that can sometimes be a potential pathway. Maybe not so much in this one necessarily from memory, but perhaps it lands on someone's vegetable patch, the substance, and then they eat those homegrown vegetables, and that can be a potential pathway. And the other one is children especially, and adults too, eat a higher amount of dirt than you would suspect. Kids are very good at eating dirt, even those who don't pathologically eat a lot of dirt. And it's actually a greater pathway than you would think in general. And the last one, there is ingestion from contact with contaminated surfaces as well. So there's all these other little bits and pieces that people do, and there's ways to calculate that. But it's rarely as simple as you would think. So we talked about hazard assessment, then we compared it against the exposure assessment, and then the next step is to compare those and characterise the risk characterization. So it integrates the evidence from hazard identification, dose response and exposure assessment. It summarises the risk, and it says there in terms of nature, extent and severity of potential adverse health effects. It really depends on the substance as to how you would summarise the risk. For some things, it's just essentially comparing a guideline value with an assessment of the exposure. So it can be fairly simple. For other things, it involves a little bit more sort of data heavy approaches. So for some things, if it's a carcinogen, there might not be a safe level, and there's data that would suggest that there's health outcomes at any level. And so there's a calculation of risk involved there, which can be a little bit more detailed, and a whole host of other approaches as well. But I think for our purposes today, we'll keep it simple, and most of the time it's comparing exposure to a guideline value. And as I said at the start, we're not doing this just for fun, we're doing it to inform something, and that's risk management, as well as risk communication as part of that. So the risk assessment should really closely inform the process of risk management. And I like to think about risk management as really three simple things, just to keep myself on target sometimes, because when you're in the detail of this and what you're talking about might actually cost a lot of money, it's important to bring it down to the basics so that you don't get off track. But really there's three things you can do. You can reduce the exposure, you can remove the source of the exposure or the people, so you take them apart. So say in this situation, you could evacuate the area. That's a big deal and it has its risks in itself. Sometimes you have a contaminated land area and you could dig down 5 meters and remove all dirt and take it out of the area, okay? So removing the exposure is often quite a dramatic kind of step to take and normally very costly or risky. And the other one is, which people don't tend to immediately think of, is accept the risk of the exposure. And not infrequently, this is actually the appropriate thing to do. And that is that the risk is actually really quite minor, and that the potential to remove all the risk would be extremely costly and might not necessarily be justified. So accepting the risk of exposure, and normally risk communication is really important there, is not infrequently the most appropriate thing to do. Sometimes you can talk to people about simple steps they can take to minimise their exposure, but it's very often part of it. And risk communication is the most important step that needs to occur throughout the whole process. You can't wait 6 months to talk to a community when they've been exposed to a carcinogen. I hope that's really obvious, but it's really important. So risk communication should always start as early as possible. So very often people say, we don't have all the information yet. It doesn't matter. You need to talk to people first, because even if you're saying what you will do and when you'll let them know more information, that's really valuable. And if you don't do that, you may lose the trust of the community before you've even begun. So just to summarise there, really important that you understand how these bits work. So issue identification, which is essentially, I've really simplified it there, but it's really making sure you've got the people's concerns right. The hazard assessment, the potential health problems by dose. Exposure assessment is the dose people received. The risk characterization is summarising that risk, and risk management is doing something about it. So now I wanted to move on to a bit of a more worked example, and we'll see if we can get some interaction going here. I've reduced the interaction a little bit because it might be a bit hard, but we'll see how we go. I have one person in the room with me, so she may get all the questions if she's unlucky. So Williamtown has been a really topical area of contamination for the last few years now. And Williamtown RAF base, like many airports around Australia, use large amounts of aqueous film-forming foam, and it was used to train firefighters in how to put out fires on planes. And it was used very often in training on the base. And some of these aqueous film-forming foams that were used previously contained PFASs, which we'll talk a little bit more about now. So the area near the airport in Williamtown is actually a semi-rural area, which is always makes it a bit more difficult, which you'll understand why soon. In this area, the groundwater is really high, and essentially what happens there is that it's sort of very sandy, I think, from memory, and when it rains, the groundwater just kind of floods back up to the surface, or if it doesn't flood, the rainwater just seems to sink straight into the groundwater. So what that suggests is that the groundwater is not overly protected from surface water. So in some areas, the groundwater can be well protected by sort of certain layers of clay and other things, but not so in this area. So any contamination of the surface would flow straight to the groundwater. Also, many areas around Newcastle have a history of contamination, and the community has a number of community groups that advocate for a number of different issues. And so that means there's community members that are, I suppose, geared up and concerned, which can be a good thing to interact well with, but it can also mean that there's a lot of suspicion because of past issues. There's a lot of suspicion of government because of past issues. So PFAS contamination. So we're just going to work through the health risk assessment now. So once again, you go, oh, the issue. Well, the issue is PFAS. You've already told me that one. But PFAS is, there's many different, PFAS is a group of chemicals, and there's many chemicals within that group. So, you know, which ones? Well, the ones we've been looking at is PFOS, PFOA, and the third one, which is perfluorohexane sulfonate. But there's lots more. Shall we consider other ones? This has been a question. The other one is that in aqueous film-forming foams, these are not the only substances. Do we need to look at anything else? And, you know, they're not so much Williamtown, but a lot of the sites, they were burning other things. So is there other contaminants we need to look at? So it can be kind of hard sometimes trying to, you know, focus and say, this is what we need to look at versus other things. But in this situation, to cut to the chase, we essentially focused on 3 or 4 of the PFASs. So the hazards from PFAS. So for PFOS and PFOA primarily, the issue is the evidence of health effects isn't very consistent. And this has been interpreted by some to suggest that it's not something necessarily we should worry about. But I don't think that's quite appropriate, and it's just the real reason why we need to take it really seriously is that these substances persist in the environment for a really long time. They don't break down. Imagine if you're designing a chemical to sit on top of water and help put out fire, then the bonds in those substances have to be really strong. And that's one reason why it persists so long in the environment, because it just doesn't break down. The other one is it persists in the human body for a long time. So the half-life is, give or take a bit, maybe 5 years or so. So if you have high levels, it's only going to reduce by half in 5 years. So it could take many, many years before, if you're exposed to a lot of PFAS, to return back to sort of background levels that everyone has in their blood. And the other part is that most of the evidence is from animals, not humans. And the evidence in animals, it's a little bit hard to bring it across to humans because the key receptor, which is PPAR alpha, is actually different in some of the animals. So the hazard is really hard for PFAS, which makes it quite a difficult space to work in because it's not clear. There is a guideline value, so thinking about dose-response relationship. Having said that, they've changed a couple of times during the period that we've been responding to Williamtown and other sites, which makes it difficult because the goalposts are essentially moving. And the change in guideline values reflects different approaches rather than a change in the evidence. So it makes a difficult place to work in, a difficult environment to work in. Now, I mentioned before about the semi-rural community. So I just thought, we'll see how this goes. But if we were thinking now about a semi-rural community, so semi-rural meaning there'll be people, sort of hobby farmers and people who have, different animals and things like that. What would be the important exposure pathways for a semi-rural community that you would think of? And that's leading to how this population could be exposed to this chemical. Because we need to get the exposure pathways right before we start trying to calculate exposure. So let's see how it goes. Do we have any potential answers to that? Wonder if... Okay, so we've got one answer there, which is water supply. So that's a really good answer, and I like that that one came first. Drinking water, like I said at the beginning, is a really important way to expose a population. And there's two types of water supply here. So I didn't mention it before, but near this area is the backup drought supply for Newcastle, essentially. There's a groundwater section there that is the backup supply for Grahamstown Dam. So there's a public drinking water supply that's nearby. And also, in many semi-rural areas, there is groundwater is used by people for drinking as well. Often we wouldn't recommend that they did that, but people who live on, a very cheap supply of water below them and feel that it's sort of a pristine supply, will still often use drinking water. So both of those are important here. We've got another one. So is water... Yeah. So in this situation, you have to think what else you're using the water for, and that's great. So often there are people are using water to water, says here, plants or vegetables. So especially in a semi-rural area, people often have the expectation when they move into these areas that they will be able to have a veggie patch. So I live in suburban Sydney and I don't grow my own vegetables, but people who live in a semi-rural area are much more likely to do that. So the first one is sort of fruit and vegetables using water. Normally for fruit and vegetables, there's two ways, just talking more generally than PFAS, there's two ways that the fruit and veg can get contaminated. One is through the dirt itself and the other is through the water. And so both of those can be important for fruit and veg. I'll just keep talking, and anyone else who wants to put in another one, jump in. But the other really important one often is animals. So one being, we just had one at the same time. So yeah, livestock is really important. So there's two main ones, chickens and beef would probably be the first one that come to mind. So chickens and eggs for lots of different contaminants can be really important. So chickens are kind of could be playing around in the dirt, and they can be contaminated from the dirt. But the main one I think here is the water. The chickens and the eggs are a really good way to get the contamination from PFAS. And for some, it's also eating the chicken. But in PFAS itself tends to really go into areas that have a lot of protein. So for cows, if you home slaughter a cow and eat the meat, and especially if you eat what's it called, offal, I think, the liver, you can get massive amounts of PFAS. So that can be an important pathway as well. We've got a couple other questions here. Aerosolized. So for PFAS, that route is incredibly small and not a major pathway, but definitely for some chemicals, it's really important. But for PFAS, it's not a major route in these contaminated sites. For background, so like just the normal small amounts that people are exposed to in their day-to-day life in their house. So there's PFAS in a number of kind of products that have been used in houses. It might be an important way that people are exposed for those. But in general, in contaminated sites, we don't think it's an important exposure pathway. And the other question is egg contamination on the shell only or inside the egg yolk? That's a good question. So it's actually inside the egg itself. It binds to the protein inside. So often, why that's a really good question is that often what we message is we'll say to people, wash your food. So fruit, veg, the contamination's on the outside. So you wash the outside and then you're safer. But no, here you can't do that because it's in the fruit, it's in the egg.
What about the manure of these animals? They like to sell manure to use as fertilizer. So could they potentially be spreading the PFAS beyond the contaminated zone to other areas? Fertilizer. So
that was a question from within the room. That's why you could hear it. So it hasn't been considered to be a major issue. And I hesitate a little bit answering, but I suspect it's not a major issue. Just thinking about it from first principles, but I haven't tested any cow poo to be sure. But the interesting thing with PFAS is that one reason why it persists in humans for so long inside the body is that there's almost complete renal reabsorption and almost complete reabsorption of PFAS in bile. So I suspect there's not a lot in urine or feces because it's so well reabsorbed. But having said that, I'm not sure how the cows go. But there's issues when people are exporting stuff in general off-site from those because the dirt and the water is contaminated. So anything you potentially took off the site could have PFAS in it more broadly. Here we go. Does showering, swimming in contaminated water pose any issue? So the showering and swimming. Now, swimming we know a little bit more about. So there's some work that looks at how much people swallow when they swim. And you can do some calculations. And I think it's about 150 mils per hour is a child, maybe 125 for an adult, something like that. N Health actually has another book that talks about all those fun topics so that you can calculate some of these things. But definitely swimming can be a source of exposure. In general, as a rough guide, if you have a drinking water guideline, which is based on about 2 litres a day of consumption of the water, people, as a rough guide, will just divide it by 10 to have a safe level for swimming. Because if you swam every day, you might be able to get up to 200 mils of exposure. That's presuming that there's no dermal absorption. It's only through ingestion, which is true for PFAS, but not every substance. So in some places, if you're showering and swimming in the water and it has dermal absorption, then it can be quite an important pathway because, it's absorbed through your skin rather than just through ingestion. So yes, that can be a pathway here too. Okay, we might stop the answers there and we'll move on to a next one, and I'll try and close this box. It won't disappear. So these were some of the main ones that were discussed or calculated for Williamtown. Not an exhaustive list, there was lots of detail, but just the main ones to bring out. So drinking water, we got recreational water, we got there at the end. Ingestion of soil, I don't think anyone mentioned. but it was definitely discussed, and you should always consider this one. It's really important for some things. Think lead, for example, really important. Home slaughtered animals, I mentioned about beef. Fruit and vegetables we had, eggs we mentioned. No one mentioned fish. We had inhalation of dust, but fish is really important for PFAS. So the fish are swimming in the water that is contaminated. Especially with PFAS, they seem to be able to get fairly high levels within fish. So that was another important pathway. So now I thought we could just try and calculate some of these out. So in a health risk assessment, you would look at all the pathways and what we would call complete exposure pathways. So what we mean there is if no one is using the groundwater, if the exposure pathway is not complete, there's no health risk. And that's a really, really, really important thing to get out of it. Perhaps if you get nothing else out of this hour, it's that if an exposure pathway is not complete, there's no health risk. So that was sort of, I suppose, part of the hazard assessment type issue there, because you can have the most dangerous chemical in the world, but if no one's consuming it, it's not a problem. So considering if exposure pathways are complete or not is extremely important. And then it leads really naturally to risk management and risk communication, which is, well, if you stop drinking the groundwater, then you don't have any exposure through that. And that kind of might seem obvious, but it's a point that is often lost, which is that difference between hazard and health risk and the exposure pathway being complete or not. But so having said that, if you do have complete exposure pathways, we normally calculate out what the health risk might be. And there's a lot of complexity here because often you have lots of different levels of, say you've got water contamination in water, of PFAS or something else. You might have sampled a whole area and you'll have, you might have 100 or 1,000 different results. And those results might change spatially and over time as well. And they might have annual cycles, they might have cycles linked to rain and other things. So how to factor all those things in can be difficult, but I'm keeping it really simple today. And sometimes the answer is just take the highest level and be really conservative, at least at first, and then try and become more detailed in time. But so what I've got here is really simple calculation. I've just tried to make it really simple and neat so you can get the main concepts. So on one side I have intake, and on the other side I have sort of like a safe level or a level of the guideline value. So on the left under intake I have the concentration of PFOS. So that might be in water that we have 0.5 micrograms per litre of PFOS. Bioavailability, very often we presume this is 100%. For those who can't quite remember their sort of pharmacokinetics and all that from med school, that's, and I might not remember it either, but essentially, the amount that you ingest versus the amount that I think ends up in your blood from memory. But you might remember that from when you looked at different medications and about how much of the medication actually sort of gets lost on its way through to the bloodstream. And then for water, but it's true for any of these things, it's sort of the amount of intake per day. And then if you consider those three things, it gives you the total PFOS intake. Normally it's done per day. And then we'd compare that against the total safe level for the PFOS. Now, we saw some guideline values before, which if you were looking closely, you'd remember is 20 nanograms, but it's per day per kilogram of body weight. So it's not just a sort of standard for everyone, it's per kilogram. So we have to sort of guess what someone's weight might be. And the problem is that everyone's weight varies and has been increasing over recent years as well. So it can be a little bit debatable, but we tend to traditionally use what's also often used in sort of pharmaceutical circles, which is the 70 kilogram male thing. So the weight often is presumed to be 70 for an adult and for a child to be 15 kilograms. So I'll show you what that should look like. So you can see here we've got 0.5 micrograms bioavailability of 1, and very simple mass, 0.5 times 1 times 2, we get 1 microgram per day. So if only life were normally that simple, that's a nice simple equation. And we can see that for a 70 kilogram person, then it's 1.4 micrograms per day. And I suppose very simply, you'd say happy days. They're below the guideline value. But I hope in the next few slides, I'll show you why it's not quite so good. And just another example there is the same thing for a child. So we can see some of these values change. Children don't drink as much water as adults, not that surprisingly. So they ingest less PFOS because of that. But they also weigh a lot less. So for a sort of normal child weight, you can see that we're actually about 50% over the guideline value for children. So it wouldn't be good there. So having that example there, I just thought perhaps we can have a bit of a play here. So we'll come up with sort of some concentration of PFOS that are sort of roughly what some of the fish were there. But maybe if we could just ask if you could quickly put in the chat there, how much fish do you reckon someone eats per day? Or at least what number would you include in here? I have to say most days I don't eat any fish at all, but this is a rural, semi-rural community that live not too far from the ocean and next to a kind of river and waterways. So how much fish do you reckon someone would use? And we'll talk about different approaches to how to do this, but we've already got one. Oh, where is it? So 150 grams per day. Any other takers? Don't be influenced by that first response. Maybe we can get one or two more. Well, do we have a thought from in the room?
Well, if you're going to go with the most conservative, there would be people there that would eat it most days. So you'd have to go to quite a high level.
Yeah. And that brings up a really important theme, which is we tend to go really conservative and then sort of peel it back. Because if you go conservative all the way through, and you can sort of see already that there's a bit of a chain of conservatism that can creep in here. Because, you know, we might say that people are eating lots of fish and they're eating it every single day, and it has the highest amount of contaminant of a fish we've recorded, and all the fish they're eating is the worst type of fish. But if you do all that and you don't have a problem, you can be really reassured. But if you do all that and there is a problem, it doesn't mean that there is a health risk to people. It means that you need to assess more closely what the risk is. But there's no point doing all the detail with all the conservative assumptions that it's all okay. Okay, we've got another one there, which is maybe 250 to 350 grams as well. So I'll just go on to the next slide. And so the interesting thing here is, so what we do, and all those things that you mentioned that people wrote are completely right. So there's this thing called, what is it called? The Australian Dietary Intake Survey, I think, which looks at a day or 2 days worth of intake of different of sort of dietary intake. So the first thing to do in this situation is often to look at that survey and see what people have been, what people on average eat. But then the first thing is, well, what do you use? Do you use the average across Australia? Do you use, some people would use, you know, the mean or the median. Other people would use like the 90th or 95th percentile. It's not clear. And then the other one is, do you subset it? So presumably if you live in Alice Springs, you don't eat a lot of fish because it's really, really hard to get fish. Whereas if you live on the coast, and people who tend to choose to live near the coast, you would think you might be more likely to want to go out and do recreational fishing. The other one is, do you include fish intake from Woolworths? Because presumably Woolworths isn't the worry here. Is it only recreational fish intake? So it gets really hard. So in general, I've included a number there, which is not that high, but which is, I think that would be, what, 80 grams per day. But there have been times where we've checked at higher levels as well. We did things like, I think we tried to subset the survey for coastal areas, but there was a lot of discussion about different bits and pieces like that, because it was pretty obvious that there's some higher levels. and you're often trying to protect the extreme, not the middle. And so if you're a recreational fisher and you're going out most days fishing, you're going to eat a lot of fish, because if you caught the fish, you're going to eat the fish. So these are the sort of people. And the last group of people is one that people forget about, but is commercial fishers. So commercial fishers in the area are probably the one most likely to be exposed, because if you go out and catch heaps of fish, well, what do you take home to eat for dinner? You eat fish because they're yours, right? So commercial fishers are one that you're often most concerned about exposure. So in this example, which wasn't all fish, definitely, there was some that were more concerning, but we can see here that the total PFOS intake with that scenario per day is less than the guideline value there. So potentially okay again. But when we go to children, very fine line right on the edge there. You'll notice that children eat less fish per day than adults, which you'd expect as well, but weighing a lot less evens it out a bit. So that's fish. Now, just a bit of background about fish there. The fish were interesting because you can often give fairly specific guidance by different species and things like that, and fishers are often fairly educated, not always educated about guideline levels and things, because in some areas there's already sort of guidelines in place, whether it be about what fish you can and can't catch for other reasons, or also based on other contaminants in the area. So they're a group that sometimes are kind of fairly attuned to these issues, but not always. So we mentioned before vegetables. So vegetables are a really hard one, because often you don't have results of the level in the vegetable itself. And even if you do, you're not quite sure if it fits every situation. So what we can do with vegetables is we can look at the water levels, and there's a sense called transfer factors, which sounds a bit fancy, but they're not that fancy. Essentially, they're saying the level in water and or soil, what it would mean for the level in certain types of vegetables. And it's just a simple sort of multiplication through. I've had fish intake under vegetables, but that should be vegetable intake still. But essentially, you just sort of multiply them together and you get a very similar thing. But by now, you should be seeing a little bit of a pattern. There's a lot of similarities in how we calculate this out, even though I've simplified it a lot. And if you see there, vegetables were not as big an issue potentially, but especially in areas that had a lot of contamination, they were still important. But you can see for the same amounts of water that were a problem if you were drinking it, there'd be less of a problem for vegetables. But it was definitely a problem in some areas still. I think I've got kids after that, but it doesn't make as much of a difference here for vegetables. And so just for simplicity, we'll presume that these are the only complete exposure pathways here. There was other things considered in Williamtown from, recreational water use, or people working in drains, or people washing their dog down and getting some water exposure, and people consuming honey, and lots and lots of different things, because, and rightfully so, they were considering community concerns as well. So they went down a lot of these additional kind of paths, and they did different scenarios of people doing lots of things together. So risk characterization, bringing it all together. So if we look at these three pathways for simplicity, we can see here that adults had no pathway that was above the guideline value. But importantly, if you add them all together, it's above the guideline value. And this is a really important point as well, which is that often in this space, people will look at just one pathway in isolation. So say you're worried about drinking water, you look at the value in water and you say, well, it's below the guideline value, we're all good. Why is everyone so worried? Or say you work for fisheries, or, say you're a fisher in the area, you go, oh, well, the value's below, it's all okay. And so on through all the pathways. Especially with a situation where you have lots of different exposure pathways, you have to be really careful because they can often add up. And in this really simple example I gave you, that's more obvious. But when you've got maybe 10 or 15 different pathways and the pathways are not immediately obvious, you could see that even if you only had 10, 20%, you'd still have to be careful. And so that's often why we will use a value where we're not sure of how many different pathways there are. We're a bit more confident here. We tend to be conservative, and for each pathway, suggest that there only be 10 or 20% of that pathway of the guideline value, in case there are other important pathways that we don't know of or haven't measured, or also just if we're doing, so say you're doing a drinking water guideline, you'd often use 10 or 20% of the total daily intake or the guideline value, not any higher. And you can see there for adults, this exposure is above the guideline value, and for kids, not surprisingly, quite a bit above as well. So what now? I just thought I would show you a few of these photos, and I think it's good sometimes when we've been through some of the theory to bring it back to reality. And so imagine you were me. So I drove through to some community meetings or to go to a press conference on this issue. And this is what I drove past as I drove into the area. These signs at the time, I'm not sure there is much around now. They're still there. I saw some when I actually went on holidays a week or two back and drove through Williamtown. And there were some signs there, but not as many as when I went out there before. But lots of these signs as you come in to go to community meetings, sort of dozens. And there was this major story on, I can't remember if there was a current affair one, I think in a Four Corners one. So lots of media attention. So this isn't just a scientific kind of endeavour. It's broader than that. There are real people's lives who are being impacted, and there's sometimes quite intense media scrutiny as well. But rightfully so, because they're big issues. So we need to consider more than just the science. This one here there was along Cabbage Tree Road. There was a number of cases of cancer that were reported as well. Cancer is a very common diagnosis, so whenever there's a contamination issue, people will start talking naturally. And even if there's no increase in cancer at all, when you've got between 1 in 2 and 1 in 3 people that will develop cancer in their life, and you've got an area where people are discussing cancer diagnosis probably for the last 10 years, you can get dozens and dozens of cases very quickly. And it can be very concerning and very sort of passionate kind of responses, or emotional responses, I should say. So the first thing is to come back to risk management. So to keep it in those headings that I talked before about reduce, remove, or accept the risk. So I've kept this really simple as well. There's a lot more to it than this. But thinking about reduce, we had advice to restrict fishing. So we said you can still have certain sort of numbers of fish per week by type of fish. And we gave out advice regarding homegrown produce, which changed a little bit over time. We as in the government as a whole, reticulated public water supply, so people didn't have to drink the water anymore. And for some pathways, there was really low levels of exposure. So someone mentioned about the dust, the inhalation. It's exceptionally low from all the modelled information. So for that, you would always try and suppress the dust, more so because dust and air quality in general has health impacts than the PFAS though. But essentially, some of those really low pathways, you have to accept that the risk is really low. So communication. I just wanted to hammer home a few of these points, which I've mentioned along the way, some of which I mentioned along the way. So the first is communicate early. So never fall into a trap of saying, oh, I just need more information before I talk to them. We'll just wait a few months and gather the detailed health risk assessment. You need to communicate early and recognise the uncertainties. In general, my experience has been communities, when you communicate early, are fairly accepting of uncertainties. They might want to know information, but if you are telling them what you're going to do and when you're going to tell them, they're much more forgiving than if you don't tell them anything and then try to sort of, I suppose, get the integrity back later on. It can be very useful to involve the community in the process. So for major issues, you might set up a reference group or a group that you can involve and interact with regularly. The other one is when you have community meetings, have one-on-one interactions. You might hear of the town hall style meeting. I think that is one of the worst things you can do for everyone. It's not just about protecting the person who's presenting, but it's also a town hall style meeting. Very few people will actually get to talk, and there'll be a number of people who have genuine concerns but don't have the kind of, I suppose, personality almost to get up and talk in front of 300 people and ask their question. So it's not actually good for many people in getting out the questions, and it also can create an atmosphere that's very hostile. So how we'd often set them up is you have a community hall, but you have a number of people to answer the questions sitting in the hall, and people might have a 6-hour period in the evening where they can come in and ask questions one-on-one to those groups. And that's a far better way to do it because everyone can ask a question and they can do it in a way that's often a bit more relaxed. And the individual interactions might be still very intense, but that's fine. That's because of the issue. It's not because of the atmosphere of this town hall style meeting. And, often you can set things up. You can provide some food and other things that create a much better sort of atmosphere for the community. I put integrity there, but it's a key thing to maintain throughout. People can be really passionate about the issues. It doesn't mean we need to yell back at them. It should be obvious, but sometimes people, when they're getting yelled at by someone, will raise their voice in reply. But these people are often been through life-changing kind of things, and to them they might feel there's a great health risk to them. There might be a health risk to them in some scenarios. And so, people that are really, really sort of angry, it's good that we maintain our integrity in response. And just last thing, when you're talking to people, it's good to have some written information because they might not think of the question at the time. And if they have a bit of information, they can read it on that. And also the written information has to have a number for people to call. I don't think that's optional. You need a number for people to call back in on at a later time if they desire. Now is that my last slide? That is my last slide. Was there any questions or comments before we finish off? Well, what's happening? So I'll just wait a minute or two for people to type because I know it might take a little while. But we'll pause. While we're waiting for anyone who has questions, everyone might be just jumping off in these last few minutes. But while we're pausing, I was just going to say, if you are in New South Wales or other states, environmental health is actually a really, I suppose, interesting place for public health physicians to work. It's not often the first place people think of because I think a lot of environmental health, sometimes there can be a regulatory sort of emphasis to it, but it's a really kind of interesting place to work, and it brings in a lot of the skills of risk communication, toxicology, and other bits and pieces that can be great. We've got a comment, our communication strategy. How do you decide on the strategy? So it's a good question to start with, the communication, I think, because it is the most important thing you can do. You'll get stuck in the science and forget how to communicate with the community. But in general, the communication strategy, often we think of the content, and there might be a whole of government discussion about the approach. And nearly all government agencies, I think all government agencies will have people who are communications people. So they're often media trained or ex-journalists, or people that have done communications type degrees, and they sort of advise on appropriate strategies. And there's been a move within government in the last few years to have kind of comprehensive strategies written every time you do anything. It can be useful to make sure you plan and you can produce sort of talking points so that everyone has similar talking points to use and everyone's on the same page. But it's important that we don't get lost in the document, a 30 or 40 page communications document every time you hold an event. It's sometimes, I think, overdoing a little bit. But you have a whole of government meeting, all the comms people come with the technical people, you talk through the general ideas of the strategy, you get the talking points straight before the meeting, which often coincides with some media or something like that. I think that's sort of the general approach, but there are sort of specialist people to document the strategy normally. So I don't see any more questions there. So unless one pops up in the next 5 seconds, I'd like to thank everyone for dialing in and thanking those who are watching on YouTube, probably in the lead up to their exam this year or next. And I hope that you do well with your environmental health questions. All right, thanks everyone.
Thank you everyone for joining today's webinar. We hope to see you next time.
Okay, thanks.
Thank you, Dr. Scalley, for your wonderful presentation.